Thank you. Our last presenter comes from the State Department and PEPFAR, Jeff Blander.
Hi, everybody. Hope you're doing well. And you realize that you have the world's largest and oldest bureaucracy standing between you and cocktail hour. So just seatbelt yourselves in. Let's see. Great. Well, it's really wonderful to be here. And, as we were saying to colleagues yesterday at the closed session, that this is in some ways more like an alumni association than anything, because you look around the room and actually there are so many of the organizations that are here represented that we've partnered with over time. So what I was going to do was go a little bit into some of the transitions that we've recently had under our chief executive, Ambassador Birx, a little bit of our philosophy of how we partner, including some of the financial models and mechanisms, and brainstorm a little bit perhaps later of how we can actually apply and layer USG funding with private sector funding, and then a very specific partnership. But again, looking around the room, it's almost as if we could replace one partnership with another because there are so many examples that we have here. So the principles that we're going to go over actually apply to all our partnerships. So, when folks think about PEPFAR and HIV/AIDS, I think the first thing that comes to mind for those who aren't as close to it, but perhaps stay in touch every now and then through newspapers or even the media, is that HIV, didn't we take care of that? Aren't we doing okay? Can't we move on to the next big thing? And actually, that's about the furthest from the case that we have. And so UNAIDS came out with a report recently showing that unless we actually started to do business differently, that actually we would be heading backwards rather than going towards a place where we would end HIV and go under epidemic control. So under this visionary leadership that we have, we've taken a look at our processes, at the way we do business, and we've said to ourselves that we really have to change the way that we are doing things. And so now, when you come into our offices and we talk about what we do in terms of the country level and all our partners, in some ways it's almost like a snapshot of going to a VC or down on the New York Stock Exchange, is that we have these incredible data systems that are being reported at the country level on a day-to-day basis that roll up to us, where we can actually look and monitor what is happening, not just at the country level, not just at the subnational unit level, but at the specific site level, and know how many folks are coming in, being treated, as well as tested and retained on a continuous basis. And how this translates is into this motto of doing the right things, the right places, and the right way. And again, without this level of sophistication with our data, it would be flying blind without radar in bad weather. So this is just an example of recent COP reviews we've had, which is our annual planning process. And so the idea of making hard choices and difficult choices based upon where the epidemic is and where the information is telling us where to go. So, for example, this is a snapshot of looking at South Africa, working with government and national systems, but really identifying where those hot spots continue to be so we can realign those resources. And I'll talk a little bit more about that when we have the example of our partnership. So, where do I sit? I have the great privilege of working for state and PEPFAR in the multi-sector responsibility and diplomacy. And I tell you, if you want to come with acronyms and long names, come to me. We have a couple doozies for you. And so within this group, we have both the multilateral responsibility as well as private sector engagement. And it's part of what we do to actually develop partnerships and think about partnerships and think about how we work with the private sector, CSOs, multilaterals, our existing implementation partners and ministries of health and others, how we can do things differently, more efficiently, and innovative to achieve epidemic control. And this is just an example, but our partnerships, while we're here at the global level, headquarters level here in Washington or in New York, most of, as you can imagine, the real work and the exciting work is in the field. So this is just an example of a snapshot of being in Tanzania recently on our acceleration for children's HIV treatment, which I'll talk a little bit about later. But just in that short period of time of a few days, meeting with all our existing partners, new private sector partners, groups that have new technologies, again, that can really effectualize how we do our business better. But the real story to tell here around this is, having been with State for, it depends who you ask. I've been there 4 years, so I'm a newcomer. But for those who know State and know our group of PEPFAR and OGAC, it's like dog years, so I'm a real veteran of this process. And having gone from where we were 4 years ago to how we review partnerships to where we are now is a 180. And the idea of going into these meetings and up front, having had that detailed discussion around the data at that site level, per client level, before even hitting the ground, you have much more strategic discussions when you're there about how you can do things differently and how you can course correct. And as discussed, it's part of our DNA, so I'm not going to really go through this too much differently. But I think one thing I'd like to draw you to is this little cartoon over here. And I know this morning there was some discussion about some of the challenges and perceptions of working with private sector. Well, we have the same issues with government, and our motto is, we're government, trust us. So you can appreciate that when we walk in or we're dealing with private sector or other partners, there are just some partners, quite frankly, it's not in their DNA to want to work with us. And as I had a hallway discussion with Gary, in epidemiology, it's, selection or focused, targeted selection of those that want to do really good work with you and want to partner. And again, BD and others around this table are great examples of the types of things you can do where 1 + 1 can equal 3, 4, or 5. And this discussion I just want to mention, so one of the big dirty words, the M word, is mechanisms. And those could be very challenging. The MOUs can take a little time, but we have a little secret where if we really need to rush something, we use the flash word, and so we can get that through, relatively quickly. But the challenge with the mechanisms is identifying those mechanisms of how we can leverage resources. We talk about in-kind, but cash. And so again, this gets into the sophistication. If you're talking about private sector, whether it's VC funding or other private funding pools or envelopes, what are the ways that we can work together so we don't have the bureaucracy weigh us down? And again, those are some really exciting and in fact emerging models. We have some innovative or innovation funds that we've launched recently. One has been around the DREAMS partnership. We have another one that was just launched at the high-level meeting the other week around key populations. But this is an area that we're very excited about, and we believe that the best is yet to come. So the other point that I just wanted to make is we heard about art and science, and again, really stressing that there's also the science to the art. So the area that we've really come a long way on is working with groups like the Children's Investment Fund Foundation, who is our partner for the ACT partnership, or just the other week hearing, for example, from the Elma Foundation, their CEO and president, saying that, the last 20% of any problem is the most difficult, where you have to put the most scrutiny of how you invest precious resources. So this is an area that we've really focused a great deal in the last 12 to 18 months. In terms of sustainability development goals, again, our portfolio aligns very well with many of them, leading to many of these tremendous outcomes that our organization is focused on, that by the end of 2017, almost 30 million men, women, and children on antiretroviral treatment, a 40% reduction in new infections of young women, and a total of up to 30 million voluntary male circumcisions, all through our chief executive, President Obama, with this bold goal for us is to end the epidemic by 2030. And here's a list of those key large partnerships that we have. And the Children's Investment Fund Foundation is one I'll focus on specifically in the next few minutes. But it's important here to recognize that within these partnerships, they do align and they do have touch points. So it's not working in silos, and that's why the data is so critical, because we can look where we are not or avoid duplication and avoid areas where implementation partners are working in the same places, but really align our resources so we get the best bang for the buck. In terms of our ACT partnership, this is something that was launched several years ago, $200 million envelope to achieve an additional 300,000 children on treatment, a $50 million envelope from SIF and 150 investment from PEPFAR. And you know, the selection criteria that we had for these countries were really greatest burden, but also the widest disparity between children and adult treatment. And again, we went through this process of looking at where the sites that we could go that would have the highest yield, as well as the most effective place we could reach the children and their families. And in terms of the technical pillars, I think one thing that's really important to point out is Pillar 7, which is the domestic resource mobilization and sustainability. So again, everything that we're going into, we look at with a sustainable lens and how we can work better with not just ministries of health, but ministries of finance, so that when the initial catalyst funds are set to end, that we know that there is some sustainability and thought from the very first step of the partnership going into this. And of course, the management structures that are so critical, so that we have not just at the global level, but the country level in terms of communication. And here is just basically the dashboard, the systems that we have in place that we can look at not just the epidemiologic and our indicators, but as importantly, the financial, the cost, as well as the sustainability. And while we've come a long way, I think we all recognize that we have that much further to go. Again, some sobering statistics which look at, I mean, even despite all the progress we've made, and UNAIDS and PEPFAR made an announcement at the high-level meeting that the drastic reduction in infections of newborns and infants and the success of the global plan, we're still facing the fact that we have close to 3,000 children who are dying each week. So again, when I look out into this audience, looking at all the types of partners that we have, from the multilateral, civil society, private sector, all the groups who are represented, by working together, we can certainly achieve our goals. But if we work separately, there's no way we'll get there working alone. So again, thanks so much, and off we go to the